told your friend you're not okay, and tell me what's wrong and why you never said.
Okay, good afternoon, everyone. My name is Sharil, along with my colleague Daniel Castro and Costas. We are from Aon Middle East, your insurance broker and consultant. So for today's awareness session, we will discuss all about ergonomics. What is ergonomics? So our speaker will demonstrate the proper way of sitting in the office or at home for long hours, how to carry heavy equipment effectively, and what are the common pain and problems. So with this, it's my pleasure to introduce our speaker from Health Bay Polyclinic, Dr. Andrzej Sulimierski. Dr. Andrew graduated from the Academy of Physical Education in Warsaw, Poland in 2005. He worked in private and governmental physio facilities in Poland, Germany, and in the US for both inpatient and outpatient setups before coming to Dubai in 2009. Some of his interests are focused on orthopedic, sports injuries, and neurological adult conditions. After 9 months of the medical residency program in California, Dr. Andrew received a recognition as an international PNF therapist, and as a result, he was asked to join one of the neurological hospitals here in Dubai. Before we start, I would like to ask everyone please to remain on mute. And if you have any question, please type it in the message box and we will try to answer this during or at the end of the session. Over to you, Dr. Andrew.
Thank you so much. Thank you so much. So very happy to see you all. Right now we have 89 people, as I see. We're expecting probably more. Can you hear me well? Yes, that's correct. No echo, no dinging anymore. All right. Okay. All right. So that's a pleasure to see you. Everybody knows CAREEM in Dubai, so I'm so happy as well and proud. And I would like to, if you don't mind, just switch off my camera. Okay, and let us focus on slides. So let us talk about the successful day at work, and let us talk about ergonomics. I believe everybody who has a successful day at work probably is using some part of ergonomics just to increase the better health. What I have to say is definitely we have to focus on one thing. This is the International Women's Day today, so all ladies, all women, all the best, and let us start the day in a very good way. So let us completely change as well the topic. Everybody who works a lot sometimes thinks about hobbies and relaxation. And sometimes we need this, that's for sure. But we also need to know how to actually work well, how to sit well, and how to get back in a very healthy way to our hobbies. So for instance, this is me. And that topic today is improve your work ergonomics. My name is Andrzej or Andrzej Sulimierski. I'm from Poland, and I'm a senior physiotherapist. So I'm broadcasting to you from Motor City today. That's my office. And we are located as a company, Health Bay, we're located in Al Wasl Road in Dubai. I hope maybe you are neighbors. And we're also located in Motor City. Our other branch without physiotherapy is also in Al Wasl Road. So we're going to talk today about ergonomics. So what is ergonomics? How to sit in the office, car, or motorbike. We have different hobbies or different work. And I know in CAREEM, there are so many people that they do different things as well. Let us talk about common pains and problems. So headaches, lower back, forearm pains, poor posture. And then later on, we'll have two things. We'll have some exercises and we are going to do it. Not together, I will just demonstrate it on pictures. And definitely something from your side, so questions and answers. So what is ergonomics? Ergonomics itself is something that increases our efficiency at work. If we are ergonomic at work, we can preserve more energy doing the same work with less effort. That definitely will decrease also the level of sick leaves, and that also increase the result of the good teamwork. So the question is how to improve it, or how to know how to improve it. Yeah, the most typical problems that we have because of bad ergonomics are situations that you might know: joint stiffness, sometimes decreased range of motion, pain, low back pain, neck pain, some muscle weaknesses as well, tingling, numbness. Sometimes if we use too much of our screen and we overuse our eyes, of course, we can be also having problems and difficulties with vision, so some blurred vision. So what influences ergonomics at work? So definitely something which is most typical is that we repeat the same, maybe wrong position or movement all the time. And that would maybe go along with, let's say, our elbow pain, or let's say wrist pain. Yeah? Other thing would be the change of body position due to work. So if we change the position all the time, that would be also the situation. From other side, the range of motion that we require for a task. Sometimes it might be a big movement, sometimes we're absolutely stiff and still for a long time. Yeah? And also ergonomics depends from our body build. So let's do the short self-assessment. Let's wake up a bit. So what do you think about pain during sitting? Do you experience pain within less than 30 minutes of sitting? Do you have experiencing pain within less than 1 hour? Just sometimes, or you have no pain at all? Of course, all of us will want to have no pain at all, but sometimes it gives us the idea that maybe there's something wrong also with ergonomics. So what about the stretching routine? Do you do it sometimes? Do you do it twice a week, once a day, a few times a day? Obviously, I would suggest to do it every day and a few times a day. Yeah. And what about the sports activities? And that's actually the big topic. So all of us sitting, all of us actually staying in one position for a long time. We can think about good way of sitting, but we cannot forget about the movement that we do after working hours. Yeah, this is the most important thing. So if we actually spend some time or doing exercises, and we're going to talk about this, then actually that will also improve the muscle memory of your posture. So you will not slouch that fast and so on. So the question is, sports activities, how often do you do it? Is it once a month only, like a walk, once a week, twice a week, maybe every day? Obviously, sometimes we don't have time, but if we can do more of activities, even every day, twice a week, that will be very advisable. And as I see, we are approaching 99, 100 participants. That's great. So definitely all of us were sitting probably, or maybe standing. And the question is, what is the perfect sitting position? And if you don't mind, I just throw in something maybe funny. This is me sailing on the boat. And why I want to show it is because, yes, I do sit here as well. And the question is how stable this sit is, or how active, or how dynamic. So we know that if we're more dynamic, then actually we use more muscles, and basically we will have probably less pain. Of course, maybe a muscle pain because we use muscles, but this is not a problem because we are still and steady in one position. So how do we sit? And there are probably different grades of sitting. And I was thinking about CAREEM as a big company. I know that probably mostly people from the office are here, but we have the sitting in the way of car sitting, sitting in the office, and sitting on the motorbike. Just an idea. So that's one of the progressions that we have to talk about. So is it the perfect position to sit all day long in the car? Of course not. We have to stretch and move. And the question is for how long we can keep it, be in this position. So we know that sometimes we have to stay in the car for a long time. But let's go ahead. This is probably the most important part. Yeah. So perfect position. For how long can you keep it? Yeah, in the office. In the office, of course, you have to focus on the task, and you have to sometimes, unfortunately, to slouch. But at least you have a way to move. You have the way to stand up, and you should do it every 25 minutes. So I know sometimes there are important meetings. We have to focus on the task. We have to focus on the meeting and talk. But it's a good idea, a good advice to actually change something at least within 25 minutes. Yeah. So in perfect position, again, the next level. Yeah, you see people on the motorbikes. By the way, probably you know this company very well. So this is the most active way of sitting. And of course, the more active you sit, the less kind of pain you might have. But this is a different story. Here, people, they might also have some wind draft and so on. So, but in terms of mobility and in terms of being dynamic, of course, sitting on the motorbike, that's most dynamic. So why do we slouch? Because this is the main question. We slouch because we maintain in one position, and there are different risk factors, mostly prolonged weight load. Yeah? If we sit in one place and then we focus on different things, our body forgets actually about good position, and we kind of naturally relax, release the muscle tension. We're getting wrong position slowly and slowly. But if we sit 8 hours a day, then definitely that's prolonged sitting. So that has to be changed. So, and why do we slouch? The easy answer is because we can. because we have so many joints and our joints are so mobile that they allow us, actually, we're not stiff. Yeah, so we are created the way that we should actually be mobile, but maintaining one position, it's not something that we're actually created for. So that's why, again, this 25 minutes every time, that should change our position. So we have different shapes of our spine, and all of them, they should be more or less similar to this, what you can see. So there should be some curvature in your neck, in your lower back, also in thoracic back. But imagine if that would be stiff. Some of us, unfortunately, some of the patients, we do have patients with stiff necks and stiff lower backs or stiff and straight spine. So this is harder for them to maintain this position. So the posterior chain is the general name of the group of postural muscles that they control our posture. And the problem when we sit a lot, we don't use these muscles. We basically neglect them, we forget about them, and the muscles, they are getting slightly weaker and weaker every time we sit. And this is very typical in these days, right? Plus, we have also gravity, which is pulling us down, and we have our body weight. So that definitely fatigues the muscles. So we definitely will talk about later about that. We have to focus on how to actually take care of the strengthening of these muscle groups. And my approach in this meeting is basically about letting you know not only how to sit, but more of taking care of yourself and be more active, because this is the best way of being and following ergonomy. So, but going back to the old style about ergonomy, the way how to sit, we should be definitely comfortable. In this moment, for instance, I'm not very comfortable, but yeah, because I'm focusing on something. So that's a good idea and a good example that I want to show something, present something. I'm closer to the screen, so obviously we should not be close to the screen. Right? This is not correct. We should be more upright. Our position should be well adjusted. As you see, that should be more or less 100 degrees of the knee flexion. We should have supported legs. Our elbows should be supported. We should be upright or even slightly backwards. And the most important, the head and the neck position should be the way that our eyes are able to see the screen in front of us. In terms of the screen, it should be about 45, let's say 70 centimeters. This is up to the size of the screen. Obviously, we have different screens. We have sometimes two screens. So then you have also to pay attention to that. What is the height of the screen? How high is that? How low is that? How far away is that? Maybe it's possible to change the screen position sometimes from the left side of your head to the right side of your head. Let's say 1 month like this, 1 month like this. And then, of course, the desk that you want to set up, it should be primary zone, secondary zone, and third zone. The more important things that are closer to you, less important things, or the ones that they might distract you, or you don't need them right now, then they are in the secondary and third zone. So what shall we use to support ergonomics in sitting? Yeah, basically. And what is the setting for that? So in the office or the car, we can use some, let's say, external help. So not our muscles, something that we call a passive support. And that might be a lumbar roll. Many of the chairs, they might be equipped with the lumbar rolls, or we can get them as well. Also, the ergonomy is basically a wrist, mouse pads to support your hands, your wrists, sitting wedges, that's again to correct the posture. And then we can think about office chairs, different kind of desks, standing desks, and modified keyboards. So lumbar roll, many people, they ask, what is that? That's basically a support for the lower back. So when you slouch, you basically round your back, and this is so normal. But if you have a lumbar roll, although your body and you would like to slouch, you cannot, because there's something stopping you from slouching, basically. So that's what we can use it for. Sitting wedges, something that might be also a part of the modern chair, that we're slightly tilted forwards, and that slightly pushes us forward from the chair, off from the chair. And that creates actually a curve in the lower back that actually pushes you to sit more upright. This is like one of the tricks that we can use for our sitting with the use of the external support. Keyboards and mouse. Quite often, whenever I go to offices to give actually a speech, a chat about this, and recently, that was like 2 weeks ago, I had a chance to meet a nice team of almost 40 people, and we're just doing things live. Then they told me that they don't use any kind of support for the wrists, although they were like a graphic designer and so on. some people, they should use it, especially if they are typing a lot, if they are using mouses a lot. So that's also a part of ergonomy. So tips for practicing the better posture are basically ergonomic setup. So these few things that I mentioned. So one is the setup of your desk. Other thing is the support from extra, let's say, lumbar rolls. Second thing is active breaks, improving the strength and improving the mobility. And then the third thing, that's what I mentioned, is the external support. So what is in common if we talk about the problems with ergonomy? Yeah, that's pain, weakness, limited position that we can actually maintain. And what decreases the symptoms is basically the fact if we have good muscle control. So you see, again, we're coming back to the situation that the muscle control, the strength of the muscles, the use of the muscles, it makes you actually sit nice and better. And that's in terms of your neck, that's in terms of your area between your scapulas, so intrascapular area. It's also the area of your lower back, also the hips. So we're going back to the, let's say, basics of being stronger. So what are the typical problems and syndromes that I see with people that they have bad ergonomy, or they don't think much about this, or they spend too much time without moving? And that already requires physiotherapy. So sounds strange, but let us explain this after a while. It's the upper cross syndrome. It might be also some issues with the upper back. That might be some scoliosis. That might be carpal tunnel syndrome. That might be obviously low back pain, and few different. Yeah, so upper cross syndrome is a situation when your chin is really going forwards. Imagine you're sitting at the desk and you want to see something very small and tiny on your screen. So what do? You go forwards, right? And you push your chin forwards, and actually that's bad for your neck. So imagine sitting a few hours at work and doing something similar. Of course, some of the muscles, as this picture shows, some of the muscles, they will shorten, some of the muscles, they will be longer, and that will unfortunately increase all the time and maintain this position. So we'll have to do some exercises to correct the neck position. Yeah. We have also problems sometimes with scoliosis. So for this, as you see, one side on the left side is shorter, the right side is longer. So that would require probably doing exactly opposite. So shortening exercises for the right side. So basically using muscles on the right side and letting and stretching the left side. Very typical problem for the ergonomy is carpal tunnel syndrome. So that's when we really overuse our hands, our wrists, if we position them in the wrong way, if we have a strange angle. Lower back pain, that's the most typical thing because of loading, because of sitting, because of turning, because of maintaining the position towards one or the other side. Yeah. So the question is ergonomy from the point of view of physiotherapy, how should it be taken? Should it be more into the active or more into the passive treatment, or active approach or passive approach? So as I mentioned before, passive approach is more of preparation of your desk, your chairs, support, let's say, of your elbows, positioning of your keyboards. But the active way of approaching the ergonomy is to be active and to do exercises that they are correcting our posture. So definitely active is better than passive as a treatment as well. Plus, we have to increase the postural exercise. So that's the main thing that I want to mention, that exercises are really important. As you see it, let's say a few hours a day. So you should do definitely sometime as well during the day, during the, let's say, breaks, some exercises that they will increase the strength of your upper back. Yeah, so like intrascapular strength or thoracic mobility. So let's come to the practice time. I'm not going to put any video. I'm just going to show you pictures that they nicely explain how to do it. And then later on, we'll have questions, so you can absolutely ask about this. So some of you probably heard or seen or maybe have the foam rollers. So that's something that I really quite advise to many people that they sit during the day. So foam rolling for the thoracic spine. We can use the trigger point balls, quite useful. You can use it also in the office. Stretches, you don't need anything for stretches. You can just do it yourself with your body. And then strengthening exercise. Obviously, strengthening is maybe not something that you'll do it in the office all the time, but there are some strengthening exercises that you can also do when you sit. And if you don't mind, I would like you to, all of you right now, to focus and think about this, that you want to focus on your neck. I'm going to show it on the video. And you want to retract the neck. So let me show you. And this is the exercise that we quite often give to everybody who suffers with the neck pain. I hope you can see me. So that's what I was saying before about the cross syndrome, upper cross syndrome. Quite often, people actually, they protrude the chin forwards. It doesn't look good, right? So this is wrong. This is something that we want to avoid as well. So what we want to do, we want to place your fingers on the chin. I hope you're doing this right now. And you want to gently push it backwards. You want to push it backwards gently. So you want to, sorry, you want to correct your position basically. And that's something that you should do, yeah, to correct. But also think about is that you want to maintain this position for, let's say, 20 seconds. Can we start right now, 20 seconds? Let's try to do it. So go backwards, pull, stay there. You want to maintain this position. Of course, you can look left and right. It's a bit awkward, I know, because that's something that we don't do every time, but it's one of the very vital exercises. So let's do it again. Go backwards. I want to flatten my back. And I want to shorten this part of my neck and elongate that part. So this is the wrong position. Rounded shoulders as well. And this is the correct position. So you can use it as an exercise. Yeah, stay there, maintain 20 seconds. You can repeat, and this you can do many times. Let me put the video off. This you can do anytime during any meeting. So I hope that from today you will start doing this exercise. Yeah. So we're talking about upper back, thoracic area. So rolling, foam rolling, very advisable for somebody who sits a lot. It's purely for the mobility this time. This is not strengthening, this is mobility. So imagine that the lady on the top, she is just sliding from left to right, and the full body weight is over that foam roller. Foam rollers are easily accessible here in Dubai. That's absolutely not a problem to get it. Maybe you have a stress room. I didn't ask about this, but definitely a good suggestion to have a few of this. Just relax your back. Unfortunately, you have to go on the floor, but there might be always a mat, so you will not get dirty with your suit or your dress. Intrascapular area, quite often tense with the muscles. You can use a tennis ball, you can use a trigger point ball. That's something that we should actually use quite often, and definitely at least once a day. Yeah, these are the muscles that are really getting weaker as we sit and sit and sit, and these are the muscles again. I'll repeat it. We have to emphasize that we want to strengthen the intrascapular muscles. Buttock, the trigger point ball for the buttock. Sometimes when we sit, there's a lot of tension, pressure. That might give us a tension in the muscles. So the easiest way is just to lean against the wall, use the ball, tennis ball, and just to press. That might be painful. Don't be afraid of that. That might be painful, but that will help to release the muscles. And we're slowly going towards the end. I see that we have still 90 people, so that's nice. I'm very happy about this. So strong muscles, better posture. Yeah. So we don't have to remember how to sit, and that's the beauty of strengthening your muscles. Yeah. But muscles, they remember that for us. Yeah. If we strengthen the muscles, they know what to do. They maintain this position, and then that leads us to basically improve posture. Yeah? So definitely a gym fitness conditioning with good technique. That's something important. Postural strengthening, as you see on the top, that might be bridges, rowing, overhead press-ups, upwards rows, pull-ups. So you see my approach for ergonomy is slightly different. It's not passive. It's definitely something towards being more active. It's something more towards actually understand that not only sitting or improve sitting will help you, but definitely you have to go out and spend some time on your body. So bridges, most typical exercise that you can do in the gym, at home, very simple. It's a good one to actually start the day with. You can actually maintain this position. You can do it on one leg, on two legs. There are many modifications. Very good exercise. But as you see, you're using mostly your muscles of your back. Yeah, and as this gentleman, he has his hands along the body. He's definitely pushing his hands down as well. Next one would be the postural strengthening. That's upward rows. So you can use even a bottle of water. You can use the rubber band like this lady, some kettlebells, some dumbbells, everything to strengthen the intrascapular muscles. Yeah. As you see, the pattern of the movement is the same over here. And she's doing something similar, but in the different range of motion and a different angle. Yeah, but still rowing, pulling movement. That's something that we want. Yeah, that's something that we should do. Because when you see that work, you don't do this movement, your muscles, they work exactly opposite way. So more of the chest muscles are being shortened, and that doesn't help develop the strength or the stability of your upper back. Yeah? Pull-ups, super strong exercise. Not everybody can do it, but it's just a suggestion that you can always actually try to get some place to not pull up yourself, but just even stand on the floor and then support yourself, hold the bar and try to activate these muscles. I bet many of you, you will feel really that you have muscles after the whole day of sitting. So go ahead and do it. Postural strengthening would be maybe also overhead activities, probably a bit less suggested. Yeah, but still good to remember. And then just to remember that the bad ergonomics might lead to the muscle tension, headaches, jaw pains. Quite often I have patients with the pain even in teeth because they have a wrong neck position, and that creates also the jaw pain. Neck pain, shoulder tension with the rounded shoulder, postural discomfort because you don't know somehow how to maintain the position, how to actually stay there, lower back pain, soxigalia, and leg numbness and shooting pain. So I think that's it from my side, and I'm curious if you have questions. I'm open to questions. I see that some people that are joining, some people they are leaving. So I would like to actually ask my friends from the IT to support me, and let us see the chat. Okay, so let me see. Let us see the questions. Let us see the questions. I will answer all the questions. And to be honest, I didn't look at the chat because I just wanted to be focused. And let me see what's going on. So I can see Mahmoud Al-Turani is asking why behind the neck, the pull-ups. It's just the idea. It's just the idea. I think that hits more of the muscles towards the neck. Yeah. It doesn't mean that you have to do the full pull-up. I believe people that they work in the office, they are not that always strong. It's more about suggestion that you should do something by pulling. You might absolutely do also some pulling from the front of you. Let's say if you're at the gym or you have some rubber attached to the wall above you. So that will be a good idea. So different options, they give different benefits, but basically behind the neck, it's not bad unless you're bending your neck too much, and that might of course provoke the pain in the neck. Let me see the next question. I think these are the all questions that I saw so far. Is there any formula on how high the desk should be? Mateusz Kulewicz. Oh, witam serdecznie. So the formula, in terms of formula, the easiest way to answer that is when you sit, your elbows should be actually on the height of the desk, and the height of the desk should meet the expectation of the height of the elbow. So whenever you sit, you have to actually focus on the chair. How high do you want to sit? And that starts from, first of all, from your feet on the floor. So feet are on the floor, then your knees are not behind the chair. They are just, in 90, let's say 100, 110 degrees. That will be the position. That will definitely push the chair slightly higher. So again, by knowing where is the seat of the chair, then you can probably come up with the idea how high should be the desk. So starting with feet, going through your knees, having the height for the chair, that should give you the idea where is the best place for the placement of the desk. Let us go ahead. Is standing while working healthier than staying seated? So, Ayman, very good question. definitely staying in standing position is healthier because you're more active, you're using more muscles than sitting. Because in sitting, you don't use much of muscles. You're just more of like passive. You are not really actually focused on your standing. If you are standing and you're slouching, you know that something's off. So definitely standing is better than staying seated. Mahmoud again, maybe you didn't see this. How to avoid having forward head while sitting when we try to focus. So how to avoid this position? So that's a habit, unfortunately. Yeah, that's a habit that people they have, that they don't focus on strengthening of the deep neck flexors or deep neck muscles or core muscles of the neck. So can we avoid it? We can avoid it, for instance, by the passive support. Let's say I was showing that sitting wedge. So when you sit on the wedge, it pushes you forward. So automatically, Mahmoud, you'll have to move your entire body backwards, and that will also help and protect the neck from going too much forward. Yeah, that would be the one. Or the second one will be to strengthen actually the neck, and then the muscles they are keeping this in mind rather than you have to focus on that. So the choice is yours, but you see that support is a passive way, or might be actually strengthening. So strengthening might be actually a better idea. Yeah, but always that's the biggest problem, Mahmoud. Yeah, so you want to focus, you will always lose the focus on your posture. You cannot remember about your posture unless your muscles are strong. So you see, unfortunately or fortunately, I'm always going back to the same thing, yeah, that strong muscle are actually only helping us. Yeah. Next person. Okay, Antonio Chao. Is it effective to use back supports while sitting or standing at work or at home when feeling back pains? So there are different kinds of back pains, that's for sure. Some of them, they are mechanical. That means that basically the body weight is really pressing and pushing muscles and joints. This is one kind of the back pains. Other kind of the back pains is when there's a pressure over the nerves, and the nerves, they give the radiation, and then that might provoke tension of muscle. So yeah, like they say, same, but different. No, it's definitely different. But answering your question, is it effective to use a back support? Yes, absolutely yes. And one of these back supports would be the lumbar roll that I mentioned and I showed before. That's the one that you're using around the back of your seat. And when you want, let's say when your body, you don't want to slouch, but your body wants to slouch, then there is a barrier. There is something that limits from that movement itself. And lumbar roll, which is a back support, will stop you. But also probably you had a question about like braces that you put and wrap yourself around. That's probably maybe more about this question. Using back supports, which is mostly used for acute patients or patients after, let's say, surgeries, it's advisable when you have severe pain, but there is one super important rule. When you use it, you also have to do strengthening of your core muscles of your lower back. And saying that, you will think, should I go to the gym to do it? No. Maybe let's do this. Let's try to do this exercise. It's a simple exercise when you basically pull your stomach in. Imagine your navel, your belly button wants to go in. So this is the way how you train the deep muscles. And whenever you use the back support, because sometimes maybe you have a lot of pain, you are, I would say that I would really strongly recommend to use core strengthening in this simple version, but super effective version of pulling the stomach in. And then if you would come to me, I would tell you, yes, you can use the support. Try to use it as less as possible. Sorry, maybe I didn't say this. I would definitely, discourage you from using the back support, but I know that sometimes there's a lot of pain. So first line would be strengthening of your core muscles, and you would definitely feel some difference. And whenever you have to use the back supports, you have to do your work, which is pulling the stomach in. And how to do it? You pull the stomach in, you keep it for, let's say, 10 seconds. Yeah, maybe more is painful. And then you don't do it every day. You do it every 2 hours, let's say, every hour. Actually, you should do it as often as possible. So again, you see that ergonomy of sitting, it's some science, but more important is the activation of your muscles. So using the back supports in sitting, I would probably not recommend, because that time also your muscles, they are getting weaker and weaker. So you have to prevent it by pulling the stomach in. So Antonio, ciao, very good question. Mahmoud again, wow, Mahmoud, you're very active in questions. I hope you're also very active outside and doing some sports. So some athletes use carb polisher to relax our muscles. Okay, this might seem extreme, but this is very relaxing. Any side effects or cons? No idea what you were talking about. I don't work with such kind of athletes. Carb polishes. Interesting story. Interesting. Maybe you will tell me about this one day, but I have no idea about this. And I think this is the last question. So I'm happy to receive more questions. I see that there's less people, so probably you are busy. So I think.
Hi team, any further question, please?
Good questions. The last question is the tricky one, probably. How did you like the session?
It's good, Doc. Thank you. It's very informative.
Very informative. Thank you, doctor.
Thank you so much. Ask me more questions. I'm here for you. I'm super happy that I can talk with people from CAREEM. This is this is amazing.
Thank you, Amy. The sitting for long time weaken the tendons?
Mahmoud, you should get some, I don't know, you should get some award. You have very good questions and you're very active. So that means that you're very aware of your posture or posture of your friends or maybe the team that you manage. Yes, absolutely, yes. In terms of weakening the tendons, I mean, let's say other way, it doesn't weaken the tendons because tendons, they are more or less the same. What might happen is we might have an inflammation of tendons. So inflammation, let's say the typical lumbago, yeah, so that will be the inflammation of tendons. So you see and you feel that you cannot move that much. And that comes quite often because you have a wrong position, you slouch yourself, and the only thing that stops you from falling from the chair, let's say, would be tendons. So you kind of overstretch these tendons and you keep them tense and tense and tense. They are not designed for that, to maintain that for that long time. So definitely you can say it weakens the tendons in the understanding of having a good posture. Yeah? And there is Pat saying, thank you, doctor. By the way, I'm not a doctor. I'm a physiotherapist and doctor, slightly different specification. We're not into medications, as you see. We're into movement. Next, Mustafa. Oh, okay. First time from Mustafa. Is there any effective way to eliminate scapular pain? Whoa, this is super big topic, honestly saying, Mustafa. So that would probably require the assessment and different ideas how to assess. But I think as the first thing would be you can stretch yourself. But then the question is, can you stretch the muscle that is sore or that gives you pain? Because quite often I see people, they complain about pain somewhere in between the scapulas and they show me the stretch for the triceps. So this is not the way. That's why we as a physios were very happy actually to teach and educate how to do it. So probably how to stretch the intrascapular area would be basically to go across your body. Yeah. And we're hitting this area right now. Or you can use, other way, you can use the ball, any kind of tennis ball. Very good question, Mustafa. Mahmoud again. Ah, yes, exactly. Amy Williams. What do you suggest is beneficial for people when it comes to light levels between the rooms they are in and the lights from their screens? Very good question. We didn't talk about this at all. I just mentioned at the beginning about the blurred vision. They should not be a big contrast. I think this is the thing. This is one. Second thing, the lights, when you look at, let's say, the screen, you shouldn't have any lights that they are hitting your eyes directly. So there should be probably some angle. You know, I'm not that much into this kind of industrial approach for the ergonomy that normally all of us will think about. But definitely there should be a bright light So in terms of lumens, I don't know what is exactly the number of lumens, but you should have something similar to the not only bright light, but the daylight. So it shouldn't be too sharp. Yeah. So should you, let's say, work in the room which is dark with your screen? Absolutely not, because it will definitely make your eyes sore. Maybe not blurred, but sore, tired, tensing your muscles, maybe even tensing your jaw because you want to see what's that. Or maybe you have to work a bit with dimming the screen. Yeah? All good? Yeah, I have here a gentleman from the IT department who's helping me a lot. We're doing good. So, Amy, I hope it answered your question. If not, then just ask again.
Thank you.
Thank you so much. Good to see you. You're sitting in the bright room, so probably perfect actually setting. I hope with some beautiful overview over the Dubai. Steven, what is your opinion on use of beanbags? Okay, so it depends. What do you do, Steven? I don't know what is your kind of work, but I will tell you the example. I had a pleasure to work with a gentleman who is an IT specialist and he's a programmist. So they stay a lot of time in one position and they really like it. But then I would say beanbags only for relaxing yourself, not for working. Unfortunately, that's my opinion. It's comfortable. I know it's too comfortable. It's too comfortable, and quite often you basically dig yourself into the position that you just basically bend yourself all the time. You really round yourself. And quite often, as you sit on the beanbag, is not somewhere up, it's just on the floor, right? So you actually push that pattern of flexing your back even more. So imagine I'm sitting like this. This is probably super wrong position. So, and that might be repeated with the use of the beanbag. So this is not good for work, I would say. Yeah, but for the relaxation, if you want to relax, but I would suggest you can do it when you lie down on your front, just to relax or kind of sleep. But work, no, please don't do it. Is that okay, Steven? Is that answering your question? Okay, Ami again.
It was more a note for really for everyone on this call that maybe not everyone actually, uses this, and maybe they do. But for those that might not be aware, on your laptop settings, you can activate a night light, which means as soon as your laptop notices that the light is fading where you're actually sat, it will start to tone that blue light down to help you so your eyes aren't straining so much. You can also set it from a time perspective. So if you don't have that actually, triggered on your laptop, I definitely, promote you all to do that. I use it. It really helps. Yeah.
That's true. That's a good point. So I just cleaned my glasses. So one idea would be to also use glasses. Amy, actually, the topic is quite interesting. Also, there is plenty of applications that they actually change the color of your application into the dark mode. So if you really have to work in a dark place or it's night, well, life is life, so we have to do it. There are options of, let's say, dimming the browsers. Yeah, so everything what is white and is hitting your eyes is actually becoming black, and the text is white. So there are these options, let's say, Chrome, Google Chrome, or any kind of browsers. Doesn't work much probably with, let's say, any kind of a Microsoft Office and other editors, but definitely that's a good idea and suggestion. So Amy, thank you for help, by the way. And Steven, yes, thank you. Okay, happy for that. Good. Any more questions? We have, so guys, we reached, I believe, we definitely hit 100 participants, which I'm super happy. Now we have 40 people. I was expecting actually more, but I'm still super happy that you stayed with me till the end. We did, wow, 45 minutes, like a good class. That's enough. Yeah, that's enough. So unless somebody has questions, then of course, Antonio, Asil, Awinash, Aina, Ayem, Elham, so many names, Joseph. I saw also some name of Mr. Mateusz, probably from my country, from Poland. So Mateusz, greetings. Mustafa, Nazia, Rula, Samir, dokładnie tak. Pogadamy kiedyś. Steven, thank you for questions. Tariq, Wajiha. Yamin. Yusuf.
Literally people from all over the world, everywhere you can think of.
Where do we have people from? Are they only from Dubai, or they are from all around, from corporate office? This I didn't ask before.
I think, Rula, did we have this out to everyone, or is it just for those in the UAE?
No, it's for everyone, not only UAE. So CAREEM
So across all our 14 countries. Yeah, amazing.
Mabruk, Urdani, Masri. And people from Pakistan here, perfect. I love Pakistani food.
Honestly, guys, thank you so much for this session. It's been really great, and it's been amazing for us to be able to have things like this for everyone to join. And it's super important, right? Because especially when we work remotely, even when we're in the office, but you know, when we're in offices, we get up to pop to the loo or talk to someone, and we don't realize when we sit at home, we can just lose the whole day just sat here, and we end up crippled over like we're 95. You know, and when we forget just that normal elements of getting up and walking around. I'm definitely one of those people that sort of since the start of this month, I told myself 10 minutes every first half of the day, I'm going to whack a song on and dance around my room and come back, just to make it something a bit more fun. So definitely everyone set yourself some time aside to do something that makes you smile a little bit as well and helps you move. It's definitely a great idea. Thank you, guys. It's been really, really helpful and insightful.
Thank you.
Thank
Thank you,
you.
Doc. Have
Thank
a
you,
nice
Doctor.
day, everyone.
Thank you, Amy. Thank you, Ruda.
Bye, everyone.
Bye.
Bye.
So thank you
Stretches
so much.
in.
I hope that you use your time wisely and successfully. I'm curious if you like this graphics. It's a very nice graphic. You like it. So funny. By the way, this is one of the Dubai-based famous NFTs. I don't know if anybody is into NFTs.
I just thought that, damn, that's a big watch.
Yeah, so that's why it's about the time. Yeah. So guys, thank you so much. What I have to say as well is thank you so much in behalf of HealthBay. So you can always contact us. I know that the way why we talk actually right now is because your insurance covers physio in our clinics. So once again, we have Wasel and Motor City. So whoever is in Dubai, I'm super happy to see you. Not only me, but we have 6 physios in total, specialized with different things, women health as well, for ladies after delivery, people who are, let's say, athletes. So we all have it. And if you're happy with this actually lecture today, small talk, then join me also on Instagram as Andrew Physio Dubai. So I think that's it from my side. And I was also asked to maybe mention that for everybody who is in Dubai, if there's any need of any kind of screening for such kind of problems, we're super happy and we're here for you as well, because we're pretty much into the awareness. So yeah, that's it. Thank you so much.
Thank you.
Thank you.
Bye.
Thank you.
Thanks.
Bye.
Take care.
Bye.
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 Hurts to